We're live. Good evening and welcome to the National Rheumatoid Arthritis Society's talk this evening is about rheumatoid arthritis and women's health. And I am absolutely thrilled to be joined here this evening with two very special people, Dr. Nighat Arif, who you will know from BBC Breakfast and Good Morning, this morning I should say, on ITV, and Shama Amin, who you will recognise from The Apprentice. So welcome and thank you so much for taking the time to join us on this conversation this evening. Dr. Nighat, would you like to introduce yourself to our audience?
Hi, good evening, everybody. Thank you for giving up your evening to come and join us. I'm Dr. Nighat Arif. I'm an NHS GP and I live and work in Buckinghamshire. I would say actually my most important role is I'm a mum to 3 kids and they keep me really busy. But my specialism as an NHS GP is women's health. Alongside that, in the pandemic, we've been vaccinating. I've been working with the UN on vaccinations, with particularly a project trying to get people confident about COVID-19 vaccine and public health measures. And that's part of Project Halo. As well as that, so I've been the resident doctor on BBC Breakfast and This Morning. And it's such an honour and a pleasure to join you guys this evening.
Thank you very much. And Shama.
Hi, thank you so much for joining us this evening. As you're probably already aware, I'm the apprentice, candidate from The Apprentice, Shama Amin. Yes, I'm a mother of 5 children, 5 boys. My oldest is 14, the youngest is 6. So I have my handful with children anyway, but then I'm the director of a private day nursery. So I have a nursery full of children as well. And as Lord Sugar said, you're here for a bit of peace and quiet, Shama, aren't you? And that was partly the reason. But yes, and that's what I do for a living. I work at the nursery. I'm the director. I overlook everything that goes on there.
Well, you're two wonderful experts to be sharing your expertise on this particular topic. And just for those of you who might be new to our Facebook Lives, NRAS is the National Rheumatoid Arthritis Society. We are the only patient organisation that focuses specifically on rheumatoid arthritis and in more recent years juvenile idiopathic arthritis as well. We are not going to be able to answer your questions live on air. We have had many questions already pre-submitted ahead of this, so we're going to focus on those. But please do, you can be commenting and chatting to each other in the Facebook chat. This will be recorded and you will be able to watch it back if you miss anything or you want to go back and think, what did they say about that? So that'll be available through our website and on our YouTube channel from tomorrow onwards. So let's get straight into it because as I said, we've had so many questions on this topic. We know that RA affects 3 times as many women as men. So, you know, it does seem a bit unfair. I think it's not fair. It's not an equal opportunities condition in that regard. So there is obviously a hormonal link in some ways. And we've got a lot of questions about pregnancy. We've got a lot of questions about the menopause this evening. But of course, one of the first things for many young people perhaps watching this that haven't yet started planning their families, there is concern about whether rheumatoid arthritis could have an impact on fertility. And, you know, do you come across that in your GP practice with dealing with women with RA, Nighat?
So the first thing, we need to understand that RA is an autoimmune condition, and the difficulty is sometimes even picking up the signs. The younger that you're picked up, the better prognosis that we're going to have, because we can preserve a lot of the joints. Now, when it comes to pregnancy, actually the data out there shows that men and women don't have a significantly decrease in their fertility chances or chances of getting pregnant. The worry is about if they're on medication to stop disease progression and whereabouts we are in regards to the treatment. Now, the first thing is I would say everybody is an individual. Your rate of rheumatoid arthritis is going to be affected by your planning to have a baby. The first things first is always planning is really important. So pregnancy is something that I deal with a lot. And actually, we do a lot around antenatal care. So even before you're getting pregnant and you're even thinking of getting pregnant, well, let's put those steps in and how you can be of a better and optimal health. If you're a smoker, please stop smoking, because we know that decreases the motility of the sperm for men and also can impact your fertility and your general health. Exercise is really important. So, and there's some of you going, oh my God, she's going about exercise, but movement. I don't care, even if it's going up and down stairs, and as much as you can possibly can do based on your ability with your rheumatoid arthritis, particularly weight bearing exercises. So by that, I mean lifting weights, and that could be just a bag of flour in your kitchen or whatever you're doing. Doesn't have to be anything significant, because that actually strengthens your bones and also your muscles, which if you are going to plan to get pregnant, for women particularly, that's really significant. And then making sure that you're getting the right vitamins. So this is where taking something like pregnant care, such as folic acid and vitamin D, making you got your zinc and your magnesium, is really important, because what that will do is prevent conditions like spina bifida and just put you in that optimum health and making sure that you are going to be able to fall pregnant. And then try and get pregnant. That's the first thing. Too many people get worried about, do I have to have sex just about my ovulation time? Do you know what? Actually, more sex the better. I bet you never thought you'd hear that from a doctor.
I hope husbands aren't listening to this, are they?
In fact, this is why we can have a bit of a giggle, I think, which is really lovely, because we always sort of get dreary and drowry about rheumatoid arthritis, and it doesn't have to be that way, because in fact, we know that the risk of miscarriage, which is what a lot of women and men worry about when they're trying for a baby, and that worry escalates when you have an autoimmune condition. Well, we know that the statistics of having a miscarriage is 1 in 3. So there's 3 of us on this call. If we, Claire, Shama, and myself, unfortunately, we would get a miscarriage. One of us would have had a miscarriage at some point before the 3 months into our pregnancy. And that is a sad statistic, even of a healthy person. We do know that in some men, particularly if they have rheumatoid arthritis, the medication that they might take, or the women who are taking medication, might be a bit of a concern. And so therefore having those early discussions is important. So if you read a lot of the packaging, particularly if you're taking non-steroidal anti-inflammatory, so I'm thinking about ibuprofen, naproxen with a stomach protecting tablet, it will say, do not take if you're trying to get pregnant. And if you're taking something like a DMARD, so methotrexate, it will also say, do not take if you're planning to get pregnant. But this is where early conversations can happen, because for some people, it might be just an idea, especially if they're rheumatoid arthritis and they're younger and is milder. They can step down to paracetamol, and that might just be all that they need. Remember, you're an individual and your pain threshold has to be assessed individually. For those who are on other medications, then what we do is we put you in touch with a gynecologist or your rheumatoid specialist, and there are better medications. So there are anti-TNF biological drugs, which I'm sure we'll talk a lot about this evening, but some of them don't cross the placenta, so they're safe to take throughout your pregnancy.
And so, Shama, you didn't have rheumatoid arthritis when you had your first children. It was only after your third pregnancy. Is that right? And you were mentioning before we came on air that you were advised to come off your methotrexate to allow it to come out of your system before falling pregnant.
That's right. Yeah. So I had my 4 children. The third time around, when I was expecting, I was advised to get off the medication if we were trying for a baby, which we were. And then I obviously conceived, got pregnant, and through my pregnancy, the arthritis completely disappeared. It just went. And my pregnancy, I had no complications. It was straightforward, just like the rest of my pregnancies. I mean, even with my twins, when I had my twins, I had a normal delivery. I had a normal delivery with my last as well. And everything was absolutely fine. Even after I had my 6-year-old, there was no sign of RA coming back for the first 40 days. And I actually believe that it's gone. It's not going to come back again. And unfortunately, after the first 40 days, I started to feel that pain again. And I thought, oh no, all their memories started to come back when I first got diagnosed with RA. But yeah, here I am, and it's life, isn't it? We just have to get on with it. But the pregnancy was fantastic, so I thought, I think it makes sense just to get pregnant again, have another baby, so I can have nothing now, all right?
Now, I maybe should have a disclaimer here that if there's a sudden baby boom after this Facebook Live, it's not down to us.
That'll be down to you, Claire.
And it is, you were talking about, sometimes we have a bit of a giggle about sex and
Yeah.
relationships, but of course when you're a young couple wanting to start a family, it can be very difficult, and often people don't know who they can talk to.
Yeah.
And we are sort of probably a bit too stiff upper lip and British, but we do have a great resource that will help with some of those conversations at NRAS. I like to call it the 50 Shades of RA booklet, but
Yeah.
it is actually called Emotions, Relationships and Sexuality. So please do, if you're in that position that you want to understand a little bit more about who you can talk to and how to start those conversations, it is important.
Yeah, and I think, Claire, I think it's really important to mention also, with the Asian community, it is talking on topics like that. It is a little bit of a taboo subject as well. People don't feel confident or comfortable talking openly about that side of life. So I just like to say, if anybody wanted to speak to me in confidence about anything, feel free to get in touch. Because while I had RA, I did get pregnant and I did have a baby. So I have first-hand experience. So if you can help anybody, it's fantastic.
Indeed. So we know that there seems to be a hormonal link between the fact that more women have RA than men in that sort of prime of life, usually between the ages of 30 to 50 is the most prevalent time for people. Once they get into over 60s, it seems to balance off between men and women. But are you aware of any studies or why that might be, the hormonal link between rheumatoid arthritis or indeed any autoimmune condition?
Yeah, and do you know what? It's so reflective of a lot of my patients who do have RA, who actually feel that their symptoms get better in pregnancy. So I'm really glad that Shama has given that oomph of confidence to everybody watching this show who might be anxious about it. Now, we know that when women are pregnant, their hormones are, well, layman's term, we say all over the place. But what we mean by that is that essentially your estrogen levels go up, and so do your progesterone levels. Particularly when you're breastfeeding, your progesterone levels go up as well. Now, estrogen is this amazing hormone, which we need to learn far more of. Now, estrogen is an immune modulator. So we need to look at how that has a benefit. And we know that it increases to something like 4,500 in our bloodstream when we are pregnant. And what estrogen is a lubricant. It brings down inflammation. It's what our immune system uses to calm down. And because our immune system isn't always active and on the go, it's not releasing all these histamines and inflammatory processes, which is where you're getting the autoimmune aches and pains of your joints and your muscles. So in fact, it's not unusual that women who are pregnant find that their symptoms get better. Conversely, when they hit midlife, so around the 40s, when perimenopause starts, actually the aches and pains might get worse. And they're like, well, I'm on the best treatment that I've got. My rheumatoid consultant doesn't understand because I'm on the right dosage that I should be, but I just can't seem to get on the aches and pains. And that's when we really should be talking about perimenopause, because we need far more research. We've got research lacking in women's health anyway. That's across the board, even more so in ethnic minority communities. And so we need to get better at that. But we do know that estrogen isn't the horrible hormone that we thought it was. There were some studies that were done early in the 2000 and 2005, the WHI study. So if anybody wants to have a look, if you put WHI into your Google, you'll find it. What they said is they did some studies on estrogen, synthetic estrogen, and found that your risk of clots and your risk of breast cancer increased. So the WHI classified estrogen as a carcinogenic. Unfortunately, that put us back in understanding hormones in women, because too many people were too scared to go towards estrogen. But we know natural estrogen from soya, for example. Now we've got estrogels and patches, and transdermal estrogen is not the same as a synthetic estrogen. And so we need to be getting far more understanding. And in fact, in COVID, I apologize, my son's talking, but in COVID times, we have found that men have been more adversely affected from COVID symptoms than women. And the theory is because obviously women have high levels of estrogen. So this is why that hormonal debate needs to happen, and we do need far more research.
And that links quite nicely into, there's been a lot of questions about the menopause, and there is some concerns about, if you're could going on HRT, hormone replacement therapy, give some sort of joint protection, or could it actually exacerbate their rheumatoid arthritis? Lots of people, if the RA wasn't triggered by pregnancy, it can sometimes be actually triggered or exacerbated by menopause, as you said.
Yeah, of course. And the myth is it only happens to old women, so women in their 70s. But actually, perimenopause starts around the age of 40. Now, perimenopause is when you're having periods. They might be erratic, they might be irregular, but you're also getting menopausal symptoms. Now, one of the menopausal symptoms is aches and pains. So joints hurt, particularly around your shoulder, around your neck, your lower back. But other symptoms are hot flashes. So I tend to start with women saying, recognize the signs first. Start from your head, headaches, hot flushes, night sweats. You might get itchy eyes, itchy tongue, or change in your taste. You might even get a change in your voice as well. So you get aches and pains in your shoulders, palpitations, feeling anxious, feeling nauseous, feeling as if you've lost your self-confidence and your self of sense. And then lower down, you might get some tummy symptoms, so irritability. A lot of women sometimes get vaginal dryness as well. So as well as getting urinary tract symptoms, vaginal dryness symptoms, irregular periods, they get what are known as vaginal atrophy symptoms. So having difficulty having sex, a lack of libido, and they might even get aches and pains in their legs and their feet, and then they get this feeling of like spiders crawling under their skin. Now the reason is because around the age of 40, your ovaries go to your body. Do you know what? I've gone through my fertility years. I don't need to be producing all this hormone anymore because I don't need to be fertile. And so drip by drip, you produce less estrogen. Remember, estrogen is a lubricant. We need it. So therefore, women who are particularly diagnosed as rheumatoid arthritis need to think about hormone replacement therapy. And also, that's also when rheumatoid arthritis gets picked up because it triggers off that autoimmune response. Why? Because of a lack of estrogen.
And I absolutely agree. We've been trying to get some more research into this area for quite some time. So coming to you, Shama, when you were first diagnosed,
Yeah.
did you get much support about, planning for your next pregnancy, and what sort of conversations are you able to have with your rheumatologist about the link between RA and your women, your fertility, or your going through perhaps early menopause, or have you noticed anything like that?
If I'm completely honest with you, when I first got diagnosed with RA, it was a bit of a shock to my system. I was in denial for a while. I was prescribed medication, but I didn't take it right from day one. I just put it to the side and I thought, no, I know the solution to the problem. I need to lose a bit of weight. I need to start exercising. I need to change my diet and I'll be absolutely fine. I actually sat there, told the doctor that as well. I said, no, I don't need the medication. There's nothing wrong with me. I'll be absolutely fine. I think I know what it is. So they gave me the medication anyway, but I'll be completely honest with you. I just put it to the side. And because I've always been fit and healthy. And then I started doing exercise. I was on a strict diet and I actually lost about 4 stones in weight because I was overweight. And if I'm completely honest with you, I don't want to pull people off from taking the medication because it is so important to take our medication. I can't stress that enough, how important it is to take the medication. But actually losing weight and doing the exercise, I actually felt the difference.
And it certainly will.
Sorry?
It certainly will help.
Yes.
It's, but it is important to do all of those things together. And that's very much about, self-management, doing what you can do and dealing with it, medication as well.
So then when it came to trying for another baby, if I'm completely honest, I didn't speak to anybody about it. The only question I had was, do I carry on taking the medication or do I stop taking the medication? So the doctors advised me to stop taking the medication 3 months before we try for another baby. So that's what I did. I stopped taking the medication. And then I fell pregnant. And like I said, throughout my pregnancy, I was absolutely fine. It was a lovely journey. There was no complications. And if I'm completely honest with you as well, I wasn't really worried too much about what was going to happen. I did have a slight worry that I hope it doesn't affect the baby. I hope the baby's healthy. I hope he's fine. I hope he doesn't have any disabilities or, because I know with methotrexate it can affect the baby's limbs and things, if you carry on taking the medication. That I had a slight worry on that side. Yeah.
I just wanted to clarify that that's in much, much higher doses
Yeah.
than what is used for rheumatoid arthritis. So
Mm.
if, you know, and we have known that people have fallen pregnant or fathered a child while being on methotrexate, and the evidence shows that there isn't any serious consequences. But of course, it's very hard to do those sorts of proper clinical trials in people that break. But where accidents happen and
Yes,
people have fallen pregnant, and the research shows that there isn't. So if anybody is out there, and don't worry too much that that will be the case. That methotrexate is used in lots and lots of other conditions as well, in much, much higher doses. And I think that's often where people get a bit scared about that drug. But it is the gold standard. It is many, many people respond very well to methotrexate. So just going on a little bit about somebody's here has asked a question about somebody had a course of oral prednisolone a couple of times and my hot flushes became much stronger. So is there a link between steroids being used and exacerbating the hot flushes for menopause? That's to Nighat.
Yeah, so the conclusive evidence isn't there. In fact, I've known some patients being on steroids, corticosteroids, like prednisolone, and their hot flushes get slightly better. Now, it could be because actually what was happening is that we do know that other things do happen. So your sugars go up if you're on steroids, and you can feel more fatigued on steroids as well. And then if you've got menopausal symptoms which aren't being managed through maybe alternative therapies or hormone replacement therapy, then your symptoms, it's just like the perfect storm, as we say in medicine. You've got your own autoimmune condition, you've got the side effects of the medication, and then you've got your menopausal symptoms, and that just makes you feel absolutely horrendous. So therefore, I think we need to be having these open conversations very early on with women who do have rheumatoid arthritis about menopause and perimenopause and what we can do to support them. Now, that might be alternatives. So there's lots of alternatives for flushes. We use a blood pressure tablet for clonidine because the belief is that your blood pressure goes slightly up because your estrogen levels are low. Remember, estrogen is a lubricant. So if you're not getting the blood vessels nice and lubricated, then you can get that sudden hot flush because your blood pressure is trying to catch up. And if you do want to consider hormone replacement therapy, now we have really safe options. So what are known as almost like body identical. So they're identical to your own estrogen and progesterone. So that can be as a gel that can go on your thigh or your shoulder, or you can take a capsule called progesterone or utrogestan, and that can also be a natural way of managing your menopausal symptoms.
And without
estrogen is going to be the best way.
Sorry.
Sorry.
Without any interaction with the prescribed drugs for.
So yes, so transdermal, so something that's put onto the skin, like a transdermal estrogen, a patch or a gel, will not increase your risk of clots, because that's the biggest risk sometimes with some of the medications. So it does not increase your risk of clots. So it's very, very safe. And also you're bypassing the liver. So you're not triggering off those clotting factors and therefore not interacting with the rest of your medications that you might be taking orally, because it's directly going through the skin. And that's why it is safe for patients who have medications that they're taking for their rheumatoid to consider transdermal estrogen patches. Now, progesterone can be taken orally, so that's a capsule, or it can be taken vaginally, again, bypassing the liver, not interacting with the rest of the medications that you're taking, as well as a Mirena coil, so a coil that's got progesterone on it that gives you the progesterone component of your hormone replacement therapy, and that stays in for 5 years. So the Mirena coil does a couple of things. It can stop you from getting pregnant, because some women might need contraception around the age of 40, protects you from endometrial cancer, gives you the progesterone component of hormone replacement therapy for 5 years.
Wow, that sounds great. You mentioned blood pressure a little bit there, and I've got to ask Shaman, working on The Apprentice, how did that work? I mean, that was high pressured stuff, and we know that you stepped away from it because of your RA. But did you feel that sort of high pressure and that stress exacerbated your symptoms?
Claire, I don't actually think it did, because I was so in my element when we were doing the tasks. I was absolutely loving every minute that I had there, and I was so focused on the tasks Yeah, of course, it's a stressful time. It's very stressful. The pressure's on. You know, the timings that we were given, we were very restricted with timings. So the pressure was on, but it might have impacted my RA. I can't say no, it didn't. But that was the last thing on my mind. It just didn't cross my mind while I was doing the tasks. I was on a mission.
Yeah.
So RA wasn't even on my mind. You know, I just got on with it. The only time RA became a problem was when I started to get swelling in my feet and in my ankles, because it came to the point where I started to struggle getting my shoes on because the swelling was very, very bad on my feet. It was, it was just not, it wasn't good. So, I was left with no choice really but to leave the process. But it didn't cross my mind. To be honest, I'm quite a positive person.
That comes across.
Yeah. I'm quite a positive person, so I don't let RA come in the way of anything that I want to do. So I've gone through the grueling process. I'm on the show now, so I just got on with it. To be honest, I just didn't think about it until it came to the point where it was becoming very painful and uncomfortable, and I had to speak to somebody about it.
Yeah. Well, I do admire you for speaking openly and publicly about rheumatoid arthritis, because it is sometimes such an invisible condition. And people go, oh yeah, arthritis, yeah, that's a bit of achy bones, my granny gets that. And it's such a misunderstood condition. So I really appreciate because you've got a platform now to really raise the profile of rheumatoid arthritis.
Yeah, do you know, what I want to tell everybody is that it wasn't easy for me to come out with the fact that I have RA, because I've had it for about 9-10 years. It's not something that I've only just recently been diagnosed with, and I always kept it a secret. One of the main reasons why I kept it a secret was because my boys were so young, they were growing up, and I just didn't want them to know that our mum is poorly or she has a health condition. Because I just didn't want it to impact my boys emotionally, because children don't always express their feelings or talk to you about how they're feeling. So I thought, right, I've been diagnosed with a health condition. I'd much rather me deal with it myself, and I'll be absolutely fine than my boys have to deal with it with me. Another thing was I just didn't, because I always have a positive attitude and I know how strong I am mentally. I just didn't want anybody to look at it as a weakness, or look at me and think, oh, Shama's weak now because she's got RA. And that always played in my mind. So for a good 9-10 years, which is a very long time, I kept it a secret. But you know what? Since I've actually come out with it and told everybody that I suffer from rheumatoid arthritis, seriously, I feel like so much weight has been lifted off my shoulders and I feel so much better for it.
And I think that will resonate. I'm keeping an eye on the little chat here in the Facebook, and so many people are resonating with what you're saying, and are thanking you for opening up and talking about RA, because it isn't anything to be ashamed of. It isn't anything.
Absolutely,
it is not a weakness. Nobody is. It's not because of your lifestyle or anything like that. And Nighat, you must see that with patients that you're dealing with rheumatoid arthritis, where they don't want to talk, they don't want to tell sometimes even their family, but their employers. But do you see it more within the South Asian population? Is it a culture? Is it worse within certain cultures, do you find?
So what Shama's saying is so typical of a lot of my patients, and there's a stoicism attached to it. It's almost like, I don't want to bother you, Dr. Arif, or I don't want to bother the doctor, because like you said, there is this sort of myth that, oh, it's just achy joints and then you'll be able to, but it actually is a debilitating condition, and it's an autoimmune condition and makes you feel older than your years. And when it comes to cultural differences, there is a vast difference, and we can't make any bones about that. Ethnic minority communities like to keep themselves insular within their own communities. There's a lot of shame attached to healthcare, because especially if you're from a community where there's a strong faith belief, it sometimes can be viewed as, well, this is a punishment from God, or Allah was going to give you this condition and it's your burden to bear. That's one thought that I've often come across, and that's, as a practicing Muslim woman, I'm saying that because I've come across it myself as well with various other health conditions that I've dealt with within my own family, Then the other condition is that there's a sort of sense of learned helplessness. It was God's will. It was going to happen anyway. So I'm going to succumb to it. Whereas we're not really forthcoming with understanding, actually, you can live a very productive life with rheumatoid arthritis. It doesn't have to be God wills. There's lots of preventative things that we can put in. Weight, Shama was saying, it made her feel so much healthier. Diet and exercise, mental health, positive mental health. There are so many taboo subjects. We don't even talk about, sex in rheumatoid arthritis. And for some, it can be so painful. And actually, it can be an agonizing thing to even open that up, especially if you're going into a new partnership or relationship. And in my culture, we practice a lot of arranged marriages. So I come from Pakistan. We have a South Asian community. I speak Punjabi and Urdu very fluently. And to know that if you're going to go to have an arranged marriage and the girl or the boy might have rheumatoid arthritis, honestly, it's horrific. They turn away marriage proposals just based on the fact that they have a health condition. And therefore, what they do is they try and hide it even more. When we have a community culture where everything has to be under the veil, or in our culture, we say below the parda.
Yeah.
So if everything is under the veil and it's hidden, it means that we don't learn as a society and as a community, and we don't pass knowledge on. Hence why we are where we are within our communities, where we are not understanding medical conditions, and our uptake of facilities within the NHS are far fewer than, say, our Caucasian counterpart. There's a fantastic data that was done by the King's Fund just before the pandemic, actually, in 2020, which showed that ethnic minority community, a man from an ethnic minority community will die 10 years earlier than his white counterpart, even if they live in the same postcode. And the reason is because there's a lot of health beliefs that we still cling on to. There's that disengagement with the NHS services. There's the fact that we're not opening ourselves up because we worry about criticism. We worry about showing our sensitive side, worried that we're showing that there's a weakness there, when actually that limits us. There's a great quote that I go by with Margaret Fuller. And she said that everybody has a candle that they carry of knowledge. And we all have a candle that's unlit until we light it. So let others light your candle in your knowledge. So everyone listening to this,
Absolutely.
You are very unique with your experience. Honestly, I, as a doctor, learn from my patients.
Yeah.
I only learn how bad your rheumatoid arthritis is if you come and tell me very openly and honestly.
Absolutely.
And that is how we help provide healthcare to our patients.
Do you know, Shama, that all resonates with you, does it? Well,
Claire, absolutely. Do you know, another thing is, with the South Asian communities as well, when you talk about health conditions, they look at it as a negativity straight away, and it's a weakness straight away. And all this, you'll actually hear them say it to you, to your face, that, oh no, you're going to go downhill now. Oh no, you're so young. Oh, your life's come to a standstill now. What are you going to do? And that does not make you feel any better in yourself at all. But I'll tell you something. The one thing I've got to say, since I got diagnosed with RA, it's made me an even more positive individual. It's made me mentally stronger. Physically, I've started taking more care of myself. And I have achieved so much in the last 10 years, even more than what I had done before that. But that's the message I want to send out to everybody. Don't ever, ever, ever let anybody tell you that you cannot do something just because you have RA. Never, because I'm a living example of so much I've achieved over the last 10 years, even with RA.
Exactly. And I think, Claire, on that, sorry, Claire, I was going to say on that point as well, because we replicate what we see. So I've been a doctor for 14 years. I've worked with South Asian communities because I live and work around Slough and around Buckinghamshire. And honestly, I would never see a Black or an Asian person on a poster for rheumatoid arthritis. I don't even see it for diabetes, which is our most common diagnosis. So the fact that, the NRSA have put a Facebook Live in with 2 Asian women, it's like all my buses have come at once.
2 beautiful Asian women.
and we're breaking taboos because we're talking about, dry vaginas, we're talking about sex and we're talking about pregnancy. Yeah. And we're openly having these conversations at a platform. And that's the joy. And I think the joy of COVID, really, if you look at some of the positives, that we've been able to see someone who looks like you represented back at you.
Absolutely.
So then you normalize those conversations.
Yeah.
And we've developed a resource on our website called Apni Jung, which is, and we have some of our resources now and lots of video content as well in Urdu and Hindi and some in Punjabi as well. So we want to develop that. But of course, you're right. You know, here's me, white middle class woman, telling people, come and have a look at the Apni Jung section of the website. But it's so useful, and you know, we know that sometimes even having leaflets in a different language isn't always the best way, and that's why we've used a lot of video content talking about cardiovascular risk, which of course is really important for anybody with rheumatoid arthritis, but again a slightly higher risk within the South Asian populations, like diabetes as well. And we're working with a great team of medical advisors to help us to develop the resources in the right way for this population that we're not necessarily reaching. But we've gone a little bit off topic but I love it. I love this nice sort of informal chat. It's great. I was thinking, you know, you talked about keeping your RA a secret, and looking back, do you regret that? Do you think it was right at the time for you, Shama, to keep it to yourself?
Right. If I'm completely honest, I don't have any regrets about the fact I kept it secret. And the only one reason I say that is because I don't know how it would have emotionally impacted my boys with them growing up. Mm-hmm. Now my eldest is 14. I have a 13-year-old. I have a set of twins who are 11, and then I have my 6-year-old. And I feel like they're a bit older now. They have more understanding. And when I'm talking to them, they are, you know, basically when I broke the news to them about the fact that I have RA, before it was going to go out on TV, I had to have that serious conversation with them. The reaction I got from them was they were very, very upset, all of them. They were very upset when I first told them that I have RA. I'm going to get all emotional now.
That's okay. And we know what that's like for so many. We hear it on our helpline, and it is tough because, you know, your mum, you're strong. Yeah. Your mums don't get sick, do we?
Absolutely.
You know, we're supposed to be able to fix everything. Yeah. But often what we hear though from mums who have, you know, their children have grown up with a far more understanding nature about, I don't like saying disabilities, because it's more about the abilities regardless of having a condition, and it does make them more empathetic and all-rounded citizens. So you know, and I'm sure they'll be incredibly proud of what you're doing, Shama.
Yeah, they are so proud. You know, their first reaction was getting really upset, and they started crying, and I was crying with them, and you know, we all just joined in. Family. It was a family affair going on.
It's good to have a good old cry and let it out. And talk about hormonal.
Nothing wrong with crying.
Yeah,
but how I finished the conversation with them was, right, boys, listen, it's something I felt was right for me to tell you, and I made you aware of it, but nothing's going to change. If anything, everything's going to get better. Mm-hmm. I said, I've had this health condition for the last 9-10 years. Has it stopped us from spending time together and having a social life and going out and having fun? And I said, everything's going to carry on as it is. And I did explain to them that it wasn't a terminal illness as well, because that's what they started to think. Oh my, you know, obviously children have questions in their minds, don't they? Oh, does this mean mommy's going to die? Does this mean she's going to get worse, etc.? I said, no, I'm absolutely fine. And if I've got the health condition, I could be positive about it. I need you boys to be positive with me.
Yeah.
And seriously, you know, after that conversation I had with them, wow, they are fantastic. They have not brought it on their tongues again. They've not mentioned it again. You know, life just carries on, and everything's absolutely fine.
I think you're missing a slight opportunity there, though, Shama. You know, that's when you get them to pull their weight more around the house. You know.
I don't want to speak too soon about my boys, but they do so much around the house already, and you know, they help me so much, because although I hadn't told them about the fact that I had a health condition, they could see the help that I needed. Sometimes I'd be complaining about my hands are hurting, or my feet are hurting, or my knees are hurting, and they did sometimes question, "Mommy, why are you always poorly? Why are you always ill? Why are you always complaining that you've got aches and pains?" And I'd always just close the conversation off and say, "Oh, I'm just feeling under the weather today. I'll be fine by tomorrow." And I always left it at that. So when I actually told them about the health condition, I think in their heads, in their minds, it just made sense that, that's why felt the way she did. Yeah. But they're absolutely fine now. Fantastic, you know. Onwards and upwards.
That's great, and I'm sure you must be incredibly proud of them as well.
Yeah, I am.
And We touched a little bit on, the I mentioned cardiovascular risk and, diabetes, and again, people with rheumatoid arthritis, and, unfortunately, often other conditions come along as well. But it's sometimes a bit confusing as to whose responsibility it is to measure and hopefully be heading things off at the pass and preventative medicine about doing the annual holistic reviews for people with rheumatoid arthritis. Is that something you do within your primary care practice, or is that something that's done within the rheumatology departments mostly?
Oh, that's such a good question, because not just diabetes, thyroid conditions as well. Women are twice more likely to get. We just have everything.
It's so unfair.
We are so unfair, and women also get thyroid conditions. We offer in the NHS. We offer what are known as NHS health checks, and they are offered to everybody from the age of 40. So men and women can have those, and that's a blood test to check you for diabetes, check your cholesterol levels, do your height and weight, your BMI. Unfortunately, we still do use BMI in the NHS as a marker, but your lifestyle, your smoking habits, how much exercise you're getting in, and most importantly, your mental health, because we know that this affects this. So Shama said about being positive all the time, and I cannot agree and echo that enough, because if you know that up here you've got positivity and lifestyle things are going okay, that's why letting employers and your work know about a condition is important. And so in fact, a lot of the time we work with employers by letting them know that this is the condition that the patient has, because the patient wants us to do it. So the GP is part of what's known as a multidisciplinary team. And so if it's your main primary diagnosis is rheumatoid arthritis, then actually the rheumatologist will do the specialist care, but then you do come back to the GP, and then we initiate and then continue. So that means regular blood tests if you're on immunosuppressants, or if you are on DMARDs, or if you're on anti-TNF biological drugs as well, because we need to do those bloods within the GP practice, and physiotherapy as well. Some people need orthotics involved in regard to, some people actually need social care and OT. So looking at how they're going to get in and out of a bath because their mobility might be affected that much. And then if you're planning to get pregnant, a midwife gets involved early on. And that's where a gynecologist with a specialism in rheumatoid arthritis can get involved. So it is really such a multidisciplinary approach. Your first primary person always is going to be your GP. Now, everybody on Facebook might be going, oh God, the GP, can't get through to them. Now, I can only apologize, and I can sincerely apologize, but let me put it into context. We are currently 5,000 GPs short in the NHS, and that's because of recruitment. We have a huge recruitment issue nationally across the board in the NHS. What COVID did was just highlight that and show us that there is an issue within the NHS. So that joined up care has actually gone haywire within the pandemic, because what happened was, to stop cross-contamination, because our rheumatoid arthritis patients are at high risk of being severely affected by COVID, particularly in the first wave and the second wave, we reverted to doing telephone and video consultations and stopping face-to-face consultations, which meant that blood tests went off the radar, scans that were booked went off the radar, your review with the physiotherapist, because it was a face-to-face and we didn't have PPE in place, went off the radar. But still, we are really trying to give that joined up service, because the service works for a majority of rheumatoid arthritis patients in the UK, in the NHS. We know that early screening, early picking up symptoms, making sure that we've got preventative care, so giving you your vaccines, making sure that you're taking, say, for example, folic acid when you're trying to fall pregnant, having those early conversations about perimenopause, menopause, looking at lifestyle, looking at your mental health, actually has far more beneficial on the long-term prognosis of your condition. And this is where I say to patients, do not always be reliant on the GP. Do you know what? You are incredibly powerful as the patient.
Absolutely, yes.
So we get to this learned behavior, that learned helplessness, and I see this a lot in my Asian culture, in my communities. They'll come and see me and I'll say, these are your options for your arthritis, your rheumatoid arthritis, paracetamol, naproxen with a PPI cover, so lansoprazole to cover your stomach. And then I can refer you on to a consultant to think about methotrexate. What do you think? And they'll say to me, whatever you say, Dr. Arif. And I'm like, no, you are the boss. So if you have concerns, we work to a model called ideas, concerns, expectations. Never, ever, ever, to anyone listening to this Facebook, please, you have it from me as an NHS GP for 14 years. I'm telling you this. You are literally autonomous constantly all the time. Always share what you're worried about. always tell the doctor, I expect you to do this. Okay. And then get that doctor to do what you want to do, because you are sharing your ideas and your concerns and your expectations and your worries along the way. And this is why we learn from you as patients.
And I think that, it takes a lot of confidence. And I think we've all probably been guilty of it when, you could be incredibly confident in your work life, in your home life, and then you're in a bit of a strange environment, a clinical environment, and that confidence goes. And that's why supported self-management is so important, and getting the right information and support. And that's why I'd encourage many of you that are watching tonight, we talked about work and talking to your employer. We have some great resources, which I hope my colleague will put into the chat now, how to talk to your employer. So a guide for your employer to explain what the condition is in lay language, and also a booklet for yourselves about I want to work, knowing your rights and responsibilities within the workplace. But again, self-care is very important, and we're running various courses called well-being courses. What Nighat just said about your mental health as well as your physical health, and exercise is so important, nutrition is important, all these things that you can take control of, that helps you to feel that RA doesn't have you just happen to have RA. It doesn't need to control your entire life. So do have a look at the wellbeing courses. They'll start in April, and the free resources that we have available as well, for employers and around the workplace as well. So I'm conscious of the time. We've still got so many questions, and I'm trying to sort of group them together in a way. Osteoporosis is another one that is often a concern for many women anyway, because it tends to be. But then when you've been on steroids or whatever, what can people do to reduce the risk of osteoporosis?
Yeah, osteoporosis, so very simply for those who don't know, is basically a thinning of the bones or weakening of the bones. Our bones are made of all these bone calcium and phosphate and loads of amazing things which aren't coming to my brain right now. It's been a long day. But our bones are made of very strong material. And then if we have osteoporosis, we lose some of that, particularly we lose calcium. And the way to build that up is to take supplements like calcium and vitamin D, but also doing bone strengthening exercises. So doing something against resistance. So that might be weightlifting. Doesn't mean that I need you to go out and get a 10 bell, late weightlifter and become a world champion, but anything that does against resistance, that could even be using a rubber band to exercise your muscles. Now, with osteoporosis in general practice, what we do is we do your risk score. So we look at your weight as well. If you're severely underweight, then your risk of osteoporosis increases. Your diet makes an impact as well. If you're a smoker, then that also impacts on your risk of getting osteoporosis. And get this, if you're a perimenopausal woman, and then if you're steroids. What we as GPs do, and what we should actively be doing with the patient who's got RA, is doing what's known as a fragility score. So that's a score of what is your chances of you getting osteoporosis and then, God forbid, a fracture. Now, it doesn't mean you need to stop your steroids. That's the first thing that people go, oh my God, there's a risk of osteoporosis with my steroids. I need to stop them. Please do not stop them until your specialist has a discussion. Thank you, Claire. Until your specialist has a discussion with you. We can now, because we are so brilliant with our technology, is pick up osteoporosis even before it happens, something known as osteopenia. And that is by doing what's known as a DEXA scan. So a lot of my patients who are rheumatoid arthritic, who have rheumatoid arthritis, what we do is that on an annual basis, we do what's known as a FRAX score and then get them into a DEXA scan process. And then the DEXA scan just looks at all the consistency of your bones and how strong they are. And then depending on that, we give treatments, even if you're on steroids. So that could be vitamin D and calcium, or lifestyle changes, or something known as bisphosphonates, which is a tablet that you take once a week in order to build up your bone mass and strengthen your bones, because osteoporosis is a preventable condition. And get this, the Osteoporotic Society has even endorsed hormone replacement therapy for women who have perimenopausal symptoms as a prevention for osteoporosis. So we are now far, far ahead of our understanding. The problem is that's not getting through to the doctors, unfortunately, and to the public. I mean, osteoporotic fractures still cost the NHS 1.3 billion in this country as a whole. And the reason being is because women, unfortunately, get a high risk of fractures. They fall, slip in the garden, and we should be catching those people because we give steroids not just for rheumatoid arthritis, but for a whole load of conditions.
Yeah.
And so we should be actively looking at it. But you can do that yourself by making sure you've got a good vitamin D. So vitamin D3 is what I recommend, about 1,000 units a day, with a good calcium as well, and making sure that you're doing strengthening exercises.
Right. And I think, just want to absolutely reiterate, if you are on regular steroids, do not just stop taking them. In fact, that goes for all your medication. You should never just stop, because that could actually have far more detrimental effect. You must talk about changing your medications or reducing medications or dosage with your rheumatology consultants. Gosh, it's been so fascinating talking about all these areas of women's health. It is really common. And for any of the men listening and watching today, we're not ignoring you completely. We might do another talk another time on men's health, but today was very much specific about women's health. And it's quite interesting that I've just seen a post on the chat of a young man who's watching this evening, who is going off to medical school after his A-levels. And I will say, please do consider coming into rheumatology, because we need more in rheumatology as well as in primary care. So I'm just conscious that we're coming near to the end, and there's still so many things I'd like to, and I know people would like to hear from you, Shama, about your journey with rheumatoid arthritis. If you were back at the very beginning when you were diagnosed, what would you do differently, perhaps, or what might you advise somebody? Somebody was just on the chat there a moment ago saying they've only been diagnosed 6 months ago.
Oh wow!
What would your message to them be, or what would you may have done differently if you had that time over again?
Do you know, the one good thing I did when I first got diagnosed was change my diet straight away and start exercising and losing weight, and that really worked in my favor. I would advise that everybody does that. Take care of your health, prioritize your health. Do you know, I've never been one of these people that's had a good diet. I've always just eaten whatever I felt like eating, and I didn't really do much exercise. So that is what I did. But to be honest with you, what I would say is, don't be in denial about the fact that you have RA. If you are in denial, accept the fact that you have RA if you've been told by the specialist you have, but don't get into the negative vibes about, oh my God, my life's going to change for the worse now. What am I going to do? My life's come to a halt. Please try to remain positive about it, because that is what's got me through the past 10 years of my life. Like I said, I've achieved so much in the last 10 years. I could have quite easily got into the rut of why me, asking questions, why me? I actually see this health condition as a blessing. Every time I speak to anybody, I always say this is a blessing from God, because everything happens for a good reason. And now the fact I'm beginning to raise awareness about RA, I'm thinking that's why it happened to me, because this is what I should have done right from day one. Don't keep your secret, because now that you've been diagnosed with RA, you need as much support as you can possibly get, whether it's from friends, family members, from professionals. If I kept it a secret, because I kept it a secret, I was not able to discuss it with anybody or talk about it, my personal experiences. They may have helped so many different people over the last 10 years. That is the only one thing I think of, and I think I should have said it sooner. Now that I feel like the weight has been lifted off my shoulders, nothing in the world is going to stop me from raising more and more awareness and speaking about it.
But
here I am. Take advantage of me.
Thank you, Shama. One of the other things that people were asking about, we've talked a lot about pregnancy triggering RA, menopause triggering rheumatoid arthritis, but there's been a few questions about stress and trauma and other conditions. Somebody who had salmonella and then it was triggered by that, or somebody that had a trauma. Sometimes it's bereavement, sometimes it's a car accident, it's all sorts. And do you see that sometimes when somebody's coming in and presenting with the early symptoms that that could be triggered by things like that?
So there's a lot of studies to suggest that stress particularly does impact our body, and particularly our immune system. I don't think that that data is undeniable anymore. Now, what happens is when we're stressed, our cortisol, which is our hormone or stress hormone, and our adrenaline and noradrenaline go up. And when they go up, they impact our immune system's ability to cope. And then when our immune system goes haywire, so it goes overactive and it just says, I can't cope anymore, it starts attacking itself because it can't see the wood for the trees. So it can't see, is this a virus that's coming into my body, or is it because it's my own cells, and it just attacks it. So that's again why rheumatoid arthritis or conditions like thyroid conditions are so common under stress, even diabetes, even high blood pressure. I mean, the list of physiological, biological conditions that can be caused by stress is insurmountable. Hence why I said we can't disconnect this from the rest of this, and we have to treat it together. And now we're getting better at that. Unfortunately, mental health, stress, anxiety, depression always used to be treated as, you know, a madness of some form, and it was so stigmatized and so taboo. But we're moving away from that. There's therefore holistic approaches. So having complementary treatments like reflexology, like acupuncture that can decrease your stress levels, yoga, all of those things actually have proven to improve your symptoms. Yoga particularly has proven on many occasions, even hot flushes, it has proven to be really helpful. And cognitive behavioral therapy, that positive CBT that you can do with a therapist, can also impact your ability to cope with your symptoms and even make your symptoms better. I'm a huge fan of complementary therapies. And for me, if they work for my patient, brilliant. All day long, please do them. I'm happy with that. And I think we need to, as doctors, not be shy to join up Western medicine and complementary medicine. So by that, I mean NHS medicine, which is NICE recommended, and complementary medicine, and do it together. The problem is a lot of the problem is a lot of complementary therapies haven't got the rigorous checks for NICE, and that's why we as doctors can't recommend anything that isn't NICE. But I know if they work for my patients and they're doing them good, there's no reason why you can't do complementary therapy.
And I think the key word there is complementary, complementing your prescribed medications, not alternative. Unfortunately, there is an awful lot of stuff that you can get over the counter, or you can, you know, order online that might promise you the earth. And, you know, we always say, ask for the evidence, see if there's, you know, robust evidence as to what they're claiming to be able to do, and talk to your medical professionals about it. But you're absolutely right. If there's something that won't interact with, just because you buy something over the counter, it could still interact with your current medications. And if your healthcare professional team don't know that you're taking it and you're, you know, developing some other symptoms, they won't know that it could be connected to that. So just check, as you said, it's complementary. If there's something that is not going to interact with your prescribed medication and will do you well and feel good, what's the harm? Definitely. But have that open and honest and transparent conversation is really important. As somebody did ask about, can RA be wholly controlled by an anti-inflammatory diet? There is absolutely no evidence whatsoever that can be, but you can definitely improve your symptoms by following a good, healthy Mediterranean style diet, little bit less red meat, and you know, nice colours on your plate. I always think if you've got lots of colours on your plate, you're doing well, because
you know, from my personal experience, this is not scientifically proven, I have to highlight. And I'm not a doctor, so I'm not giving you medical advice on it. This has been tried and tested by myself. Ginger, as much ginger as you can eat, have that. Turmeric in hot water, have a hot cup of water, put turmeric in it. It actually it's made a difference to my joint pains anyway. So I'm just putting it out there. If it's made a difference to my joint pains, it's worth a try. And again, ginger in hot milk. And you can just have try to eat the ginger raw as well. It's really strong, but you try and eat it raw a little bit, not a lot, not large, huge amounts, you know, but just a little bit.
And I think the thing that Nighat said earlier, you know, you're all very different. And just like that's why we're fortunate now to have such a huge array of medications.
Yeah.
And if you're confused about your medications, we've got a great resource booklet to explain all these different medications. Why do we have to have so many medications for rheumatoid arthritis? Because it's actually more of a syndrome than a one disease. It's not a one size. So likewise, what works, some people say, I can't even look at a strawberry, but I'm going to flare. Other people are like, I can have loads of straw. So it's working out what works for you. As I said, we've got a well-being course on nutrition that you can join, and it's working. It's kind of keeping a food diary, I think, is always useful to know. Oh, that's interesting. When I had that sort of made my joints worse or caused a flare, and it's working what works for you because you are all different. That's why it reacts differently. We are out of time, unfortunately.
Right, can I just say, Claire, can I just say one last thing, please,
Yes, please.
before we draw everything to an end? I'd just like to say to everybody that's suffering from this health condition that please, it's just a humble request from myself. Try your best to remain as positive as you can. We all have our good days and bad days. Certain days your RA will be worse than other days, but just try your best to think positive, because that will help you so much to get through this horrible condition that we have. And just please try to remain positive. I'm a living example of somebody who tries to be positive all the time, and it's made my life so much easier because of it. Sometimes I'll be crawling out of bed in the morning so stiff, and I'm thinking, oh my God, how am I going to get through my day? And I do, and I strongly believe it's because of my positive mind that I get through the days. So I just wanted to say that, and we're all in the same boat, so let's get through it.
I'm sure that would resonate with so many people. But, on the counter side of that, it's okay to have rubbish days, and it's okay to have a bit of a cry and a moan and scream and shout and be frustrated.
Yes.
That's perfectly normal too.
Oh, I did.
Let it out, but then, pick yourself up, brush yourself off, and, Thank you so much, Dr. Nighat, for joining us this evening. It's been fascinating. I hope we can do it again sometime. It would be lovely to do something with you both as part of our resources for the South Asian population. Maybe do something in different languages. A Facebook Live in Urdu would be great, or in Punjabi. We'd love to do that. Thank you so much. I'm really looking forward to continuing our working relationship with you both thank you everybody for listening and staying with us. I'm already having a look at some of the comments. They're really, really positive. Everybody's saying thank you so much for an interesting talk. I'm sorry if we didn't get to answer your particular question, but hopefully we covered off most of them. Just to finish off, we've had a lot of conversation on social media about the Plan A, and I was going to avoid COVID conversation altogether, but please do take a look on our website for the latest recommendations and advice on that. I would recommend, but that's my own personal, keep wearing your mask, because that is the best way forward, and it's keep each other safe, but I think things will begin to start getting back to normal. But if you need any further information, visit our website on the COVID information. You can phone our helpline as well. Thank you so much. Have a good evening, and thank you so much for joining us this evening. I really enjoyed it.
Bye.
Take care.
Bye.
Bye.
Bye.